Doctors, what's one time your patient gave you medical advice? I had a patient with the worst eating habits known to man, so much so I was getting ready to plan his funeral. He ate fast food for every meal, rewarded himself with something sweet after he was done, and then downed an alcoholic drink. He was overweight, always in a bad mood, complained that even though he never did anything, he was always tired, and had severe brain fog. But what was most worrying was the excruciating pain in the upper right side of his abdomen. After lots of examinations, we found out he had fatty liver disease. The disease affects 25% of Americans, and the numbers rising rapidly, though most people suffering from it aren't even aware they have it, and if left untreated it can manifest into multi-organ failure. I told my patient that all the alcohol and processed foods he consumed had piled up around his liver and slowly choked it. Now he was on the brink of having this disease and he would die if he didn't take my advice. We talked about how to lead a healthier lifestyle, and I prescribed him medication to reduce the amount of fat in his liver, and 3 months later he came back looking healthier, and I could tell he was feeling better. He didn't look tired or on the verge of falling asleep, and he had also lost some weight, though it wasn't a huge amount since it's harder for people with fat in their liver to lose weight. He also said his brain fog went away, and he stopped forgetting where he put his keys or his wallet. I asked what changes he had made, and it turns out he completely disregarded my advice. He was still having a sweet treat after every meal, still eating processed food, and was still drinking. Granted, he was only drinking once or twice a week, but given that his last blood work indicated he shouldn't be drinking at all, I was baffled. I ran some tests on him again, and when I got the results, I noticed that the fat surrounding his liver had significantly decreased. I had never seen results like his before, but I congratulated him and told him I was glad the medication had worked exceptionally well, even if he didn't change his habits. That's when he said something that made my jaw drop. He hadn't taken the medication I prescribed. He ignored it, and was taking an everyday liver vitamin every morning instead. He said the results I saw from him were because of the everyday liver vitamin, and that left me stumped. It explained why I had never seen this kind of result in a patient with a fatty liver, and why he was able to keep his old habits and still improve the health of his liver. It made me curious enough to give it a shot myself. I knew my liver wasn't damaged, but I figured it's always good to do something that will prevent a very common disease. I took 2 capsules in the morning like recommended, and within a few weeks I was pleasantly surprised. My messed up sleep schedule improved because of the vitamins. I wasn't groggy in the mornings, which is something I thought was going to plague me forever since I'm a doctor. I also noticed a decrease in the amount of brain fog I experienced, and I wouldn't trade the clear thought pattern I have now for anything. To be honest, I'd recommend the large majority of people take something like the everyday liver vitamin. Fatty liver disease kills, and if I have to choose between simply taking an everyday liver vitamin or cutting out junk food, I know what I'm choosing. Do you?